this morning to take care of some chores, some errands. This next video that I'm gonna present to you guys, it's gonna be a little different from my normal videos because I work with patients that are very ill, and probably you could say they're dire ill because they're cancer patients. And they always have a lot of questions in reference to their insurance. What's covered, what's not covered, deductibles, out-of-pockets, co-pays, co-insurance. I mean, it'll drive you crazy. So I figured I'd do this video. It's off the norm, which I normally do, but I think it's gonna help a lot. And I'd like to go into insurance basics. And one of the things is whenever you're renewing your policy for your insurance, or at the end of the year when you resubmit for your insurance, especially if wherever you work, or even if you're shopping for insurance, one of the main things, and you don't think about this, is your cancer coverage. Check that out. Chemotherapy, drugs. Look and see what you're covered for. Ask, don't be afraid. Also, if you're concerned about this too, the well-being of your relatives, find out about the term life insurances and things of that nature, because that's gonna help out too. It'll take some of the stress off of them should something happen to you. But anyway, going back to the deductibles and out-of-pockets and stuff like that. If your policy has what's called a deductible, okay? What that deductible is basically what you have to pay before your insurance will pay anything. So I'm just gonna throw some numbers out there. Let's say your deductible is $1,000, okay? And then it says your out-of-pocket is $2,500, and your co-insurance is 20%. Okay, basically what that means. Okay, and there's a lot of ifs to that because it depends on your insurance policy. Okay, your deductible, you have to pay the first $1,000. Okay, you're responsible for that. Okay, wherever you go. Then once that is met, okay, the second responsibility you have is the percentage of your out-of-pocket. Okay, so I know I'm starting to talk Chinese here, but so how that works is you're gonna get the $2,000 out-of-pocket, right? Okay, keep that in mind. Let's say the office visit is, and I'm just gonna throw some numbers out there like I said. The office visit for your doctor, and it's something that applies to your out-of-pocket, is $100, right? What the out-of-pocket, how that works is you're gonna be responsible for $20 of that $100. Okay, so if you understand what I'm saying, they're gonna cover 80% of your responsibility amount, and the 20% that you have is gonna be your responsibility. So again, if the office visit is $100, okay, and you have an 80-20 policy, they cover 80%, you're responsible for 20%. That means exactly what I just mentioned. The $100, $80 of that they're gonna pay for. $20 you're gonna pay for. But the good thing is that $20 is going to come off of your out-of-pocket. So if your out-of-pocket, and I'm going to throw another number out there, is $2,000, you just got $20 taken off of that. So now it's $1,980, okay? And that happens every time you apply something from your out-of-pocket responsibility. So now you go and you have a treatment done, okay? And again, that treatment is $100. You're gonna be responsible for 20%, and the insurance is going to cover 80%. So again, they're going to cover $80 of that bill, and you're going to be responsible for another $20. So again, now it's going to come off of your out-of-pocket, right? So if you're understanding me now, that's how it kind of works. So now let's keep going with the scenario we had, and your out-of-pocket is $1,980 from your previous, okay, because it's falling down. It was $2,000. You got $20 off the other one, and now you're going to get $20 off of this one. So now your out-of-pocket went down to $1,060. So if you understand, every time you pay that out-of-pocket responsibility, it comes down that amount, okay? Until you're met, and then you're covered at 100%. But there are some plans that the co-insurance amount is perpetual. So what does that mean? Okay, you've met your out-of-pocket. You think you've met your out-of-pocket, but no, it keeps going. You're always responsible for that 20%. And some policies are like that. So you got to be careful what you got and how you pick it, if you have that capability, because some jobs, they just give you what they give you, and that's it. You may have two kinds of policies: a policy that's a higher end policy, which is more expensive, and you have a lower end policy, which is you have coverage, but the coverage is very limited. It's not the greatest. So keep an eye on that. All right. And I'm going to go into some other things in reference to when you need an authorization for a procedure, or I'm going to go into PPO policies, HMO policies, and how they kind of work, okay? And I'm just going to put this out there, if you have any concerns or questions in reference to some of these insurances, leave me a comment, let me know. And I've done this for a long time. I've worked in different phases of the medical arena. I've worked with patient care. I've worked in administration, and also a lot to do with insurances and in reference to authorizations, coding, billing, all that stuff. So, I've done it for over 20 years. So, again, I'm going to go into some different aspects of it. So if you have any questions or any concerns, leave me a comment and I'll go into it, okay? So more to come. Okay, so now I'm going to go into PPOs. With that type of insurance, you can basically have the freedom to go wherever you want. If you're having some kind of special procedure, though, you do want to be proactive and find out if it needs authorization, so you save yourself a lot of hassle. First thing you're going to need to know is what is called a diagnosis code, and they're usually they call them ICD-10, and they're diagnosis codes. Okay, just remember that. You're going to ask your doctor for that. What's your diagnosis code? Okay. The second thing you're going to ask for is your CPT code. That is basically a procedure code, what it is that's going to be done. So you're going to ask for the diagnosis code. It's going to be a weird number with a decimal point and then some other letters or numbers. So you're going to get that. You may have several. Okay, then the next thing you're going to do is you're going to get your CPT code, which is the procedure, what it is that's going to be done to you, be it at the facility, be it at the outpatient center, office, whatever it is. Okay, with those two things, now you can call your insurance and you're going to tell them that you're going to have this done. They're going to ask you, what's your diagnosis code? You're going to tell them. And also they're going to ask you, what's your CPT code? Well, do you know the procedure that they're going to do? Say, yes, I have the CPT code. Give that to them. All right? Then the next thing you're going to do is you're going to ask them if authorization is required. And if they can give you a general idea of what it's going to cost for you to have this done, because they can do that. Okay? Then the next thing you're going to do after that is, once you get all your information, you find out how much it's going to be, if authorization is going to be required, anything like that, okay? The next thing you're going to do is, when you finish talking to that person, don't hang up yet. Ask them for a call reference number, okay, and who you spoke to. These are very important, okay? These are going to be tools that you can use later on should something go awry. In other words, you had a denial, or they say it's not covered. No. You can come back and say, no, I spoke to one of your representatives. This is the call reference number, and this is the person I spoke to. Very important. Hang on to that information. And I'll tell you why, because when you have something that's denied or is not covered as per what they say, when you give them this information, it's recorded. They always have this, okay? With that being recorded, two things can happen. They'll come back and say, okay, yes, it'll be covered and done deal. Or they may even write off, okay, the procedure, the charges for the procedure for you. So I mean, there's a couple things, important things that can happen, so keep that in mind, okay? Those are things you're going to need. So again, the ICD-10 code, also the CPT code, okay, which is the procedure code, which is what is being done. Those two important factors, all right? And that's a pretty good way of keeping track of what's happening with your PPOs. PPOs work exactly the same way. A PPO is going to have a deductible. It's going to have an out-of-pocket. It's going to have a co-insurance. Okay? Some of them, depending on your plan, if it's a Medicare replacement plan, remember that term, Medicare replacement. Okay, what does that mean? That means that your Medicare is kind of like sitting in the background. It's not going to work anymore. The plan that you have chosen to be your replacement plan is now going to take over. They're going to work under the same guidelines as Medicare. They're going to cover the same things. The same rules apply as Medicare. Everything. Okay? The only thing is like I said, your Medicare is not going to take a back seat. It's just going to be there. It's not going to do anything. Your Blue Cross Blue Shield or Humana plan or whatever it is you pick as a replacement plan for your Medicare is now going to be the primary. Okay? Now there's another thing that a lot of people do is they get a supplemental plan. Well, that supplemental plan is great, but do your research on that too, because there's a lot of things that it will cover, and there's plans out there, Plan J, Plan F, things of that nature, and they cover everything. I mean, they're secondary to the Medicare plans, but they cover everything, and those are great if you can afford them. They're a little bit pricey, but those are great plans. Then there's a bunch of other plans. There's Plan I, Plan N, Plan G. I mean, there's a bunch. Those type of plans, they cover some things, but they don't cover other things. So you got to be aware of that, because let's say if for some reason you go to a hospital visit and you're thinking you're covered because you've got your Medicare replacement or your Medicare, and now you're thinking, well, I don't have to pay anything because I've got everything covered. No. If you have, for example, like a Plan N, okay, you'll be responsible for your deductible. And Medicare has a deductible. Right now, it's $185. Next year, that may go up. It's been going up steadily every year. So your plan, the way it's going to work is that that supplemental insurance, and I'm just throwing out there Plan N as an example, is not going to cover your deductible. So you're going to be owing $185 from the get-go, okay, if you're being hospitalized or if you're having a surgery, okay. Next thing is, then it's going to cover the 20% of your Medicare, okay. And when the Medicare, when you have a Medicare replacement plan, how that works is it's going to work just like your Medicare. You're going to have a 20% responsibility, and then it's going to cover at the Medicare allowable rates. Okay, so what does that mean, Medicare allowable rates? And I'm just going to throw this out there as an example. You're having a colonoscopy. Okay, your colonoscopy is going to be, let's say, $1,300 normal billing for normal insurances, Blue Cross Blue Shield and all the others. All right, at Medicare allowable rates, that same colonoscopy will be actually like $300, because that's what the contracted rate is for a colonoscopy. And I'm just throwing this out there. That isn't the exact price, but just so you have an idea of the difference. When it's a commercial plan, they have no choice. They have to. That's what they bill at. But now at Medicare rates, which is a government rate, it's going to be much lower. Okay, so all the services provided by your provider, your doctor, your hospital, are going to be at Medicare rates. Okay, when it's a Medicare plan. So keep that in mind. All right. I'm going to go into detail on some other things now with the PPOs and the replacement plans, so you guys can have an idea. So I'll be right back. All right, guys. Switching gears here. I'm now actually walking my daughter's puppy. This is Sophie, and taking her out for a little bit. But I'm going to go on now to speak about the HMOs. So HMO insurances, when you have an HMO insurance, it's a health management organization type insurance, and what it is basically, it's a managed care plan. So these are a lot more affordable, and they're getting more and more popular as time goes on, because of the financial difficulties that a lot of folks are going through. It's a cheaper insurance, it's a lot more affordable, and the only thing with it is they're generally good plans, but it just depends on who your care provider is, and how attentive they are to your needs. There's a lot of factors in there. One of the things is if you need a referral to see a specialist or something of that nature, if they're lacking in their attentiveness, it can take you a while to get that, and you may lose your appointment, and I mean it can be a pain. So with the HMO plans, the main thing is yes, they're cheap, their copays are low, and usually responsibility amounts are fairly low, because they're a type of either a commercial managed care or a Medicare replacement, as I mentioned before, type plan. So basically what you're going to do is, if you have an HMO plan, again, be proactive. If you have plans on seeing a specialist or anything of that nature, don't wait for the physician that you want to see, the specialist, to reach out for help, or not for help, but I mean for a referral. Be proactive about it. Get to your physician, your PCP, primary care physician, in your plan, and let him know what you want to do and where you want to go, and ask him for a referral. I mean, be proactive about it. Don't wait till your specialist reaches out, because by that time a lot of time may have passed by, and you're gonna lose out in getting the care as soon as you want. So I would suggest be proactive at it. Get with your PCP, your primary care physician or organization, let them know what you need, and get your referral done. Because if you don't, again, it's going to take a while. It may take a few days, depending on your the workload that your PCP has, depending on the person who actually does the referrals. So I mean, there's a lot of what ifs. Okay, so be proactive at it. Get that done. these plans are generally not... Sorry, I had an interruption there. It's amazing how when you get a phone call, it blocks out your video. But as I was saying, these plans are generally not too bad. But you do have to, again, look at the fine print. See what's covered. See what's not covered. Look at your deductibles, your out-of-pockets, because these plans are going to have the same thing, your co-insurance. And again, if it's a Medicare replacement plan, look at your PCP. Do some background check on them. See what type of a doctor they are. If their ratings. I mean, don't be afraid to look. Just don't take it for granted that the plan you have is a good plan. There's many of them out there to choose from. There's the Aetnas, the Blue Cross Blue Shield HMOs. There's Freedom. There's Optimum. I mean, depending upon what state and what area you live in, there's a ton of plans that you can look at. Generally, if you ask me my opinion, and again, this is just my opinion, if you are able to have the Medicare, get a good supplemental, and you're basically covered. I mean, you're good. The thing is if you can't afford the supplementals, because they tend to be, as I said, a little pricey, do your homework, shop around, check out different prices on them, and the most important thing is just don't go by price alone. Look at your benefits, look at what it's going to cover, because that's when you may end up having surprises hit you when you're in need, and then you're having to fork out hundreds of dollars, maybe thousands, because some of these plans can get pretty expensive. I mean, some of the services can get pretty expensive, procedures. Some of these plans have a $6,700 out of pocket, all right, and no deductible. What does that mean? Well, it means that the deductible, you don't have to put out anything complete for your services rendered. The out-of-pocket, again, it's going to work at that 80-20, which I explained in the beginning. So you're going to have a coverage of 80% of whatever the charges are, and then 20% will be your responsibility. So again, that can be a good and it can be a bad thing, because if you're having a surgery, let's say, and the surgery's $10,000 total, guess what? You're gonna be covered for $8,000, but $2,000 has got to come out of your pocket in order for you to have the surgery done. And again, there's options there too, because right now a lot of the hospitals are doing payment plans on the remaining out of pockets, so that could be a good factor too. You know, you do a payment plan with them for the rest of the year, you're covered at 100% because you've met your out of pocket. I mean, it just depends. There's many factors out there. So if you have any questions or concerns on something, send me a comment, and I'll do a write-up on it. I'll let you know what I think, and again, we'll take a look at the different plans. If you have a concern on a certain plan, I'll take a look at it for you, and I'll do a little video on it, because I know it's a crazy world out there with these insurance plans, and a lot of the times it can be devastating when you come to find out that you have a serious illness, and now the doctor or the hospital is asking you for money on top of that. I mean, it may sound inconsiderate on their behalf, but again, they get paid for what they do. I mean, they can't do these services for free, because if they did it for every patient, they'd be looking to get some support themselves from one of the government agencies. In other words, they'd be out of luck. All right. So again, and in this world, nothing is free. So take a look at your plans. Remember what I mentioned about the ICD-10, which is the diagnosis codes, and also the CPT codes. All right, those are usually all numbers. Usually, I mean, sometimes they have letters in them, but ask for those. Check out with your insurance if authorization is required. Find out, be proactive, because these things are going to help you in the long run. It may keep you from having to wait 2 to 3 weeks for an approval or a procedure that you need to maybe a few days or even the next day. So if you're well informed on these things and you have your information about you, you're going to be just fine. And again, take a look at your responsibility amounts. What's your out-of-pocket? What's your deductible? Are there any co-pays? Because sometimes certain procedures, let's say a PET scan or radiology scans. Look at this tough girl. She's trying to be tough with a couple big dogs out there. But anyway, co-pays. As I was saying, radiology procedures. I'm going to throw an example out there, like a PET scan. A PET scan can cost you, depending on your insurance, a few $100 to $1,000. And some insurances have these little clauses in them, which is great because it's just a copay where you only pay $200 and you're covered for services rendered, or even $50 and you're covered for services rendered. So find out about that also. Find out about scans. What type of scans are covered? What type of scans are not? PET scans, CT scans, X-rays, all these things are going to help you in the future when you run into a situation when you're going to need this service. So take a look at that, and I'm sure you're going to feel much better in the long run when you know what you're looking at. Because don't go in there blindly thinking your insurance is great and it's going to cover everything, because you may be in for a huge surprise. Okay, so I hope this video has helped out. Again, if you have any questions, something you're not sure about, feel free, leave me a comment, and I'll take a look and see what it is, and if I can leave another short instructional video, I can go into some commentary in reference to it, and that way hopefully I can help clear up some of the madness out there with the insurances. If this video is liked a lot, I'll go into more detail into the different insurances, just depending upon what everybody's looking at. All right, so again, this is not my normal video, but it's kind of what I do for a living, so I hope that helps out. Okay, so folks, I really appreciate you guys watching my videos. So Rover Dude, again, out. And again, thanks for watching. If you like, subscribe.